I want to talk now health news because we know millions of Americans reach for an over-the-counter pain medication every day, but many don't know that if they're even taking the right product. Meanwhile, health misinformation is a big problem these days with all of the AI out there. It's making it harder to separate fact from fiction. So joining us this morning, trying to cut through some of this noise, Dr. Theodore Ted Lyons II, a pharmacist with the American Pharmacists Association. Dr. Lyons, thanks for joining us. Talk to us about how misinformation is affecting why people or the way people treat some common ailments like a headache or pain or a fever.
Right, because you have access to so much information now, whether it be through social media, AI, or even old wives and family tales, people are addressing their pain, their fever, their headaches in ways that may not be as healthy as they should. So what we want to do is make sure that they're speaking with their pharmacists, going in and giving us the information that they have about their symptoms, and that way we can help them select the best medications for them.
So it's not taking time away from a pharmacist to talk about their over-the-counter medication?
No, it's what we do every day. Is why we got into the profession. No matter whether it's over-the-counter medication or prescription medication, our job on the healthcare team is to be your medication information specialist. So when you want to know about medications, you're coming to the person that's their job every day.
So what are some of the common mistakes then people make when they take pain or fever medication?
Some of the common mistakes are overdosing, taking too much medication, whether it be because you're giving a child an adult medication or because you're taking more than one medication. You have a cold, so along with your cold, you have a headache. So you take medication for the cold, it has pain medication in it, but you also take medication for the headache and you think you need additional medication, and that's the same medication sometimes. And so you can be receiving twice the dose or more.
Yeah, I was going to say, what do people do then to check if they're combining meds, on a special occasion?
Yes, the best thing to do, again, is to speak with your pharmacist. But if you turn that box and that label around on the back, you'll find out all the ingredients in there. And those main active ingredients, when you see the same thing in your pain medicine as you see in your cough and cold medication, then you're taking the same thing twice. Again, speaking with your pharmacist, we can help you choose which medication will be best for you and safest for you.
Is there a difference, or, how do you compare the accessibility to a community pharmacist to another healthcare provider when it comes to having questions?
Definitely. The pharmacist is the most accessible member of the healthcare team. We often work in pharmacies that are open late at night, even 24 hours a day sometimes. So being able to access a pharmacist, even in your grocery store, is easy. So definitely, we are the most accessible healthcare provider. So your pharmacist is who you want to speak to about medications.
All right. Anything else we should know today?
Just definitely reach out to your local pharmacist. That local pharmacist has all the information about your medications, and they can talk to you in, as I always say, a language that I can understand, because you're from where I'm from. Please reach out to your local pharmacist.
Yeah, that's a good piece of advice there. All right, Dr. Lyons, Dr. Theodore Ted Lyons II, thank you for the time this morning.
Thank you, Jane.